everyone, my name is Ann Victor. I am the Vice Chair for APTANJ Student Assembly. I'm also a third-year physical therapy student at Rutgers North. Today we're continuing the interview series, and today I have with me Dr. Pancholi, who is a physical therapist and also one of my TAs for my pediatrics class.
Hi everybody.
Hello, welcome. Thank you for taking your time out to do this interview with us. We really appreciate it.
Okay.
I personally think her accomplishments are truly fascinating and can inspire and educate us all. So let's get started. First, I'd like you to just tell us about yourself, what you do, your background, anything.
Well, I have been a physical therapist for about 18 years. I know, sounds like a lot when I actually say it out loud. I have always been passionate about pediatrics.
Mm-hmm.
Ever since I was very young, I knew I would go into some sort of healthcare that was focused on pediatrics. And when I found physical therapy as my passion, I made it my point while I was actually at Rutgers North, UMDNJ back then. I made it my point to really communicate with the pediatric professors, the ACCE, Dr. Faye back then, to ensure that I do get rotations in the pediatric field. So that's where my pediatric love had started. I was placed in a pediatric rotation in a school-based specifically, and I absolutely fell in love with it. When I graduated, I actually passed off a few orthopedic jobs, full-time jobs, because I was really hoping to land the pediatric position. And I did, just waiting for all the paperwork to go through. It took me a little bit, but I was just happy to say my first official full-time job was in pediatric in school-based. I did school-based for the first 5 years. That was specifically focused on school-based, but I always kept my feet wet in outpatient, skilled nursing facility, hospital, inpatient type things. Yeah, just because you're a new grad, you always are afraid to lose your skills and things. Yeah. So I always made sure that I kept my feet wet in other areas. As I was looking at other areas, I realized that my passion is truly for pediatrics. So I found a position at PRNJ, back then it was called, and with Marissa Muccio, who is my business partner now, but at that time she was my employer. And she exposed me to outpatient peds and early intervention. So I was able to be exposed across the lifespan in that sense for pediatrics, which is early intervention, which is 0 to 3, school-based, which is 3 and up to 21, and outpatient services for children with neuromuscular diseases or conditions. And I absolutely knew that was my passion, and I continued. Shortly after working for her, she did ask me to be her partner, so I did eventually give up my full-time school-based position and went and worked for her. And expanded our business together to include school-based services. So currently we have a different practice name, it's PRNY, and then we added something called Scoliosis Specialty Center, which focuses on 3-dimensional scoliosis specific exercise, physiotherapeutic scoliosis specific exercise. It's in research, it really is identified as PSSE. And so now our outpatient is really more focused on the scoliosis and not so much on the neuromuscular condition, but we continue to have early intervention and school-based services through our practice.
Okay, that's awesome. Yeah. So it's mostly for, again, this interview, I'm interested in pediatrics, which is why I was really looking forward to interviewing you and anyone else who'd be interested in pediatrics. So you said you knew from the beginning that you wanted to do peds, there was no other, but you kept your feet wet, you tried out different things, and then you were like, no, peds is my calling.
It just solidified my initial instinct that this is where I need to be.
Right. And there aren't that many Schroth certified physical therapists in this area, is that correct?
Yeah, I mean, we definitely have some, there are a growing number of therapists. It is an intensive certification program. There's 2 levels of Schroth. It is mostly with adolescent idiopathic scoliosis that you really apply this method with. It's very different than your general physical therapy. It is like neuromuscular reeducation component. It's a training program. It is not something that you do to someone. It really is something that you train somebody else to really employ within themselves. It's a motor learning concept. So it is definitely something that's more difficult to just implement in a regular outpatient type setting.
Yeah. So what would you consider some of like the challenges that are unique to this setting?
So there's a couple of areas since our practice kind of spans across different settings. The biggest challenge is always as a therapist, you have to make sure documentation. Since ours is so specific, there is no general documentation for Schroth. We had to develop our own documentation from evaluation to reevaluation to daily notes to discharge summaries. We had to actually from scratch. So there is no online documentation that allows us to seamlessly blend into something. So that is something that we had to create on our own.
What would you say are the things that like give you pleasure, like like this is why I chose Peds, like this is what's like
it's my day-to-day, it's my day-to-day what I achieve with my patients, from the smallest little, when you are working in schools and a kid is able to come down the stairs safely or jump forward and participate with their peers that they weren't able to before, or their parent comes to you and says, look, they have enough core control and now they're actually riding bike with our family. Those small joy, it really is what keeps me driven to participate. For my scoliosis patients, when a patient comes to me and say if they've stabilized their curve and they've had 3 inches of growth spurt and their curve is still the same or has improved, those are successes. When parents said, thank you for helping them be pain-free, or a patient says, I have, no more pain because of the exercises you have provided. It is those small achievements that
so
are really
little
big.
Things.
It's a little thing, but it's a big thing for that patient.
Exactly, because we were having a conversation prior to the interview about how like it can be emotionally draining for some people, but you just have to look at the little accomplishments, like what they're able to do now that they couldn't before, and take it in stride and not take it personally. Like if like certain kids don't progress as you want them to, but that's how it goes. Absolutely.
I think it's important to objectively look at what you are doing. I tend to compartmentalize my emotions and objectively say, where did this child come from and where they're heading? How have I made them be a more integrated part of their school community or their home life? And how have I helped them
improve their quality of life?
That's it. Absolutely.
That's truly, Are you involved professionally, like in APTA, like or in the pediatrics section, anything like that?
I am a member of APTA. I have not done any big things, though. A few years ago, when something called the BRACE study came out, which was in 2013, the APTA was given the task to provide a formal written response, and I was part of the task force that was involved through APTA to formulate a response, and thereafter also update the actual scoliosis information. I believe it's on Move Forward. On the APTA, so I've helped with some of the rewrite of that.
Got it.
On scoliosis.
And you said you were also doing some research in...
Absolutely. So I'm also, because the scoliosis is now such a big part of my practice, I am a member of something called SRS, which is the Scoliosis Research Society, as well as SOSORT, which is a conservative kind of research society, which involves people from all areas of scoliosis care, from orthotists to physical therapists and physiatrists, surgeons, so across the gamut of care that could be provided to patients with scoliosis. And having been part of all those societies, I have presented my work via poster presentations. We have done an IRB funded and reviewed survey of Schroth therapists in North America, and we're in the process of getting the manuscript completed with my partner and Dr. Kaplan from Rutgers North. So that should be submitted soon, as well as I'm really blending my two love of children with neuromuscular issues and Schroth, and I'm in the process of submitting a written case report on one of my patients with SMA and how we employed scoliosis-specific exercises and how he had stabilized his curve and actually improved his kyphosis by 50%.
Wow.
So he improved his kyphosis by 50%, his scoliosis was stable, and he improved his PFTs by 50%.
And how old was he?
Actually, no, he didn't improve by 50% in PFTs. He went from being mild obstructive into normal values.
Wow.
And we started at the age of 8 with him. He is 13 now, and he recently did have a progression because he grew really fast. But his doctor is completely floored because we've just saved him from many growing surgeries.
Right.
Because when you have surgery at a younger age, you have a growth modulated, a growing rod surgeries, and that requires multiple surgeries over time. And basically he skipped all of that. So even with the progression, we're hoping to really push off that fusion until he's pretty much done growing.
That is awesome. Thank you.
It is. So.
Do you have any views on residency? Like, do you recommend one, or are you indifferent, or does it depend on the person?
I really think it's an individual choice. I think each student, if you are thinking about residency, like you, and we were speaking earlier, and we were talking about what are the areas you're going to get exposed to in a residency. And yes, there are definitely great benefits. It's probably a wonderful mentorship that you get. It's a more focused mentorship. But it starts with your rotations. You have to first see, right now you haven't really worked with Peds yet. So you're already thinking residency, but you have to first see how you're doing with your rotations.
That's true.
Is it really sparking that love for you? Go and explore those residencies. Ask questions. What are the areas that you're gonna see yourself grow in? I never did a residency, but I kind of fell in love with school-based, and I knew that was my calling. It allowed me to continue to explore other areas. Like I said, when I went into early intervention and I went to outpatient, and now adding the Schroth as my background. So I think for me, it was more about finding a place where I had great mentors and I'm allowed to grow within the area that I'm interested in. So that is the first and foremost. Find a place where you have that mentorship and you are going to be growing. The other thing is, if there are research opportunities, like over here, we're growing a research areas that interest us, that is definitely more unique, things that are not being done elsewhere. So all those things that drive me professionally are available in a setting where a residency was not required. So for me, it was not a choice that, and also when I was in your shoes, there were not that many residencies available. So maybe part of my viewpoint is based on what was the availability when I was in your shoes.
Yeah, no, that totally makes sense. The only reason I was thinking about residencies is that, like, if you want to do it right out of school, you have to apply like a year early, so you have to like research all your options, and like there's like so much variability within each Peds residency, because some of them like concentrate more on like inpatient. So you really have to do your research, which is why, like, after talking to Dr. Bowlby, it was best to just like take a year off where you're like working in a setting and like really like seeing like you have like some like baseline knowledge, and then you go into a residency and really like you're able to apply and learn that much more, I feel.
Absolutely. It'll help you focus your more career,
Right.
so to speak, instead of you just trying to rush through something that you think you might be interested in doing.
Right.
It will help focus your drive.
Thank you. Are there any classes or courses that you took like in Peds that you recommend, like any like students or like entry-level PTs or PTs who are working with kids should take?
Oh, absolutely. So I'm going to be name dropping, so I'm not sure if that's
For sure.
allowed.
Yeah.
But I say 3 classes changed the way I thought about Peds and just about physical therapy in general. So the first class is Mary Massery's, If You Can't Breathe, You Can't Function.
Mm-hmm.
It will completely change the way you practice, no matter what area of practice, Peds or otherwise. Okay, so I highly recommend. It's a 3-day course. It's amazing, and Mary Massery is a phenomenal speaker. So it's always wonderful, and I've taken her course, I think, twice already. Second is Jane Steer Acevedo's developmental course. It's like a baby course. So really, to what you learn in Peds class, it will kind of add and then take it up a notch on how to really treat children from 0 to 3. And then she also has additional classes on older kids and how to really use handling techniques. So it is a neurodevelopmental techniques, NTT based, but it completely changed the way I look at children, how I handle the children. And then you think, oh my gosh, when I first came out, I was terrible. You know, of course, all that thought goes through your head because you've completely changed the way you practice when you're working with younger children, and the emphasis on, you know, where your hands are and how long do you have to wait, what is the facilitatory pattern that you are trying to generate. So all the things that you learn in Peds class, like I said, it takes it up a notch. And the third is, again, I'm biased, and it's my Schroth training. It completely changed the way I look at a human body and the idea of 3-dimensionality, that even when I'm working still with my children in schools and I'm doing evaluations or I'm working with children in school, I recently did a medical coverage at a special needs school, and several of the therapists came up to me and were like, oh my gosh, how you address that kid, because I came to them and I said, well, this child has scoliosis. I'm not going to do X, Y, and Z with them, but this is how I would do it. And, you know, it's really nice to see that even in my usual everyday work life of school-based, which I absolutely love, I'm taking my newer knowledge. I mean, I've been a certified therapist for 8 years now. So it's newer knowledge and really applying it to the same patient, which I would have treated very differently 10 years ago. So it really, those are the 3 components of classes. So the first 2, definitely, if you're thinking Peds, go do those classes. If you are interested in scoliosis and kyphosis, then Schroth,
Yeah, thank you so much. That was very informative, like especially like I said, for people who may be interested in Peds, current students thinking about like physical therapy. It was really informative, and just because are they just like continuing ed courses or
they are?
Yeah.
So both the NDT classes and Mary's class are 2 to 3 day classes. Where Schroth is an actual certification. So that is a whole different ball game. That might be a little tougher to kind of employ into your everyday, and especially if you're not really focusing on the actual spine stuff. I am trying to put together a CEU. I've just been asked to put together a continuing education course on how to employ 3-dimensional strategies for therapists that work in school settings.
That is awesome.
So that is something that's on my bucket list that I'm going to be putting together hopefully this year.
So in conclusion, do you have any tips for any students who are currently in PT school, interested in going into Peds, like are graduating?
Well, first and foremost, congratulations. I really think it's the best profession, but it's a biased opinion. But my advice to all students is always that you remember why you went into this profession. Okay, that's the first thing. So always kind of hold on to that idea. Why did you go into this profession? So whether it's Peds, whether it's ortho, whether it's a medical field, or whatever drove you there, wonderful. It got you to the point. Now, when you graduate, there's going to be lots of options for you. And what I told you before, there's going to be lots of avenues that you can go into. I always tell my therapists, no matter what place that you decide that is your place when you start, make sure it's a place that has mentorship. Having that mentorship, I credit a lot of my personal growth in my career to having wonderful mentors. My first job was at UMDNJ at the Newark Therapy Services. So, I had wonderful mentors there, and then joining my business partner here, and she was a mentor of mine. And I made sure that I got to places where I had wonderful senior therapists that can guide me so I can be a better therapist to my patients.
Thank you so much. Thank you for your time.
My pleasure.
Appreciate
My
it.
pleasure. Thank you so much for coming out to my clinic.
Of course. And I had a request, if you don't mind, do you mind showing us around your clinic?
Sure, no problem.
Okay.
All right, so we have our amazing managers over here.
Nice.
Hey
guys.
And this is where we have our 4D motion analysis. It's a posture analysis, and it also does gait. We have the leg axis over here. It's called the Deers for metric scan. It uses light to evaluate and kind of create a picture of the spine. So using topographical mapping.
Perfect. Thank you.
So this is definitely a radiation-free option for some of our patients. We use it as a biofeedback, kind of motor learning process, so they can see before and after. We do implement it into our program as